Dr. David Satcher joins me now in the studio. He's the former U.S. Surgeon General and a former director of the Centers for Disease Control. He's now director of the Satcher Health Leadership Institute at Morehouse College School of Medicine. Thank you so much for joining us. You were very involved in an outbreak in what was then Zaire 20 years ago. Why has this particular outbreak in West Africa spread, but there have been other outbreaks that have been contained?
Well, 20 years ago, the outbreak in Zaire was fairly well confined to a hospital and a small community. It was not easy to cross borders. I think West Africa is totally different in terms of the ability of people to move. In fact, 30% of the people who died in the 1995 outbreak were physicians and nurses in the hospital. So it was pretty well confined. This outbreak has not been confined.
And in terms of dealing with it, it just seems like the healthcare systems have not been able to deal with this and collapsing even more. How do you see this playing out? The statistics are terrifying.
Yeah, and even in 1995, the World Health Organization, with support from the CDC and others, played a major role in containing that epidemic after it killed about 250 people. But I think in West Africa, and especially now that this is so widespread, the infrastructure, the health infrastructure has been severely damaged. We've lost physicians and nurses. Hospitals are crowded, which also means that other problems are not being dealt with very well, like HIV, AIDS, and malaria.
Or childbirth or immunizations,
right,
all of those basic health cares. But in terms of infrastructure, we're reading stories about the goodwill of people from around the world, sending containers of gloves, equipment, and it's all been stonewalled at harbors or not being let through immigration in a lot of these areas. I mean, this is about also local governments having to change the way they operate.
Yeah, the infrastructure is a real problem. And when we talk about the strength of our public health system, we're talking about our infrastructure, not only of trained people, but of facilities and other things. And we have to understand the world is not necessarily like that, but we do live in a global community. So as long as Ebola can run rampant in West Africa, we're all at risk.
So with that, how long does Ebola live outside of the body, say on the surface of an aeroplane?
Well, I think what's generally stated is about 5 to 6 days. But I think we all feel that we should not allow fluid from the body of a person with Ebola to survive. We should clean surfaces rapidly and thoroughly, and we should protect people against body fluids from a person who has Ebola.
With that in mind, lasts more than 5 days, around 5 days. Are you surprised not more people outside of West Africa have not been infected,
Well, I'm not surprised because I understand a few things that, number one, Ebola does not spread through the air. Secondly, one has to be ill with the disease in order to spread it, unlike some other diseases. But by the same token, people with Ebola have a very rapid course, and so they're not spreading it as long as people with some other diseases. Unfortunately, they die rapidly.
One last question. You used to head up the CDC. Do you think there have been mistakes made here in the U.S. in dealing with this one case?
Well, obviously, there were some mistakes made in Dallas, and there will always be mistakes. I think the CDC is doing a great job. I think Tom Frieden is an outstanding leader of the CDC, articulate, courageous, clear. So I think, yeah, there are going to be mistakes, but we have to be vigilant.
So should people be scared?
People should be concerned. They should certainly not panic, but we as a nation should see ourselves as members of a global community. And therefore, we should say, as long as this outbreak is spreading, we're all at risk. That's what led to the eradication of smallpox, that attitude. That's what has led us to almost eradicate polio. Our attitude, as long as it's there, we're at risk.
Okay.
Unfortunately, we don't have a vaccine.
No. Thank you very much.